Namaste, this is Dr. Rukma Rajendran from Divineveda. Today I am back with you with yet another new topic. Before that, let me ask you some question. Do you suffer from severe back pain which radiates to the lower abdomen and with the association of painful urination? And you want to know the natural remedy and what are the diet for it? Then you're watching the right video. Today, we will be discussing on the topic renal calculi or commonly which is known as kidney stone. I am sure most of you who are watching this video would have experienced or know someone who have experienced through this painful condition. Kidney stone or renal calculi is one of the most common frequently heard disease in the world. Its pain is unbearable that it's given an average pain scoring of 7.9 out of 10, which is very much similar to the labor pain. And 1 in 1000 patients, it may become a severe condition that it may require a immediate hospitalization. The chances of reoccurrence is very high. For this, our diet and lifestyle plays a very important role. The occurrence of renal calculi varies due to various factors such as first one, geographical factors. It is most commonly seen in the people living in dry and warm area or warm region. That is why this region is called stone belt regions. There will be dehydration due to which urine becomes more concentrated and it leads to the stone formation. Second, gender. It occurs more in male than in female with a ratio of 2:1. It is because of the male anatomy. That is because as the length of ureter is more in male than that of a female. Also because of the probable reasons like higher body weight, higher caloric intake, larger portion size and intake of meat, fish and poultry, and also higher sodium intake. Third, age factor. The more incidence is between the age of 35 to 50 years. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Diet, excess body weight, some medical conditions, and certain supplements may cause kidney stones. Kidney stones can affect any part of your urinary tract, from your kidneys to your bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. In Ayurveda, kidney stone or renal calculi is compared with Mutra Ashmari. Mutra means urine and Ashmari means small stones or pebbles. Let's see what all are the causes according to Ayurveda. They are dietary factors includes improper food habits like overeating, untimely food intake, unwholesome food like sour, spicy, salty, dry foods. High oxalate foods can also trigger the kidney stones. Spinach, almonds and cashews, beetroots, cocoa powder, lady's finger, sweet potatoes, excessive intake of animal proteins. Eating too much red meat, poultry, eggs and shellfish, it makes your body to produce more uric acid and indigestion. Excessive intake of processed foods. Phosphorus is a common preservative used in processed foods. So limit fast foods, bottled drinks, frozen foods. Excessive intake of alkaline foods like orange, cranberries, vegetable juices, molasses. Low water intake can lead to the formation of cystine stones, which usually runs in families. It makes a natural substance called cystine to leak into your urine. Excess sugar, dark colored beverages, artificial fruit punch, and sweet tea are the top drinks that contribute to kidney stones. This is because these beverages contains high amounts of fructose, which are ultimately known to contribute to kidney stones. Excess sodium intake. If you eat a lot of sodium, which is an ingredient in salt that raises the amount of calcium in your urine, once you finish eating, an extra oxalate sticks to the calcium in the kidneys that can produce stones. Improper lifestyle. Improper lifestyle includes suppression of natural urges, sedentary lifestyle, incomplete evacuation of waste from the body, excessive exertions, loss of sleep, stress, and strain. With the overexertion or exercise, you are more likely to perspire, and it can finally lead to dehydration, and overall, the urine concentration will be increased. And if you are inactive, you may be losing your bone strength, which could result in the loss of calcium from the bone. The calcium is filtered by the kidneys, and a large amount of calcium may not be able to be reabsorbed. Instead, excess calcium gets excreted in the urine, which can lead to the stone formation also. Environmental factors. Environmental factors includes dry and warm climate, work type. If you work in a high temperature or stone belt regions, you will be having dehydration and concentrated urine. And also, if your work situation does not offer you the freedom to go to the restroom when needed, you may restrict your fluid intake in order to accommodate the lack of facilities or the time needed to go to the restroom. This will cause your urine to be concentrated and increase the chances of forming kidney stones. Other factors. Other factors which triggers alcohol and beverages, strong medications. Let's see what is the pathogenesis or the samprapti of renal calculi. Due to the causative factors, urine becomes more concentrated. The acidic nature in urine will be increased and the watery content in the urine will be reduced. With this, the salts get sedimented. Finally, it forms the stones. As a result, the flow of urine is obstructed, which forms a condition called dysuria or painful urination associated with burning sensation, headaches, etc. Common symptoms will be severe sharp pain in the side and back below the ribs, pain that radiates to the lower abdomen and groins, pain that comes in waves and fluctuates in intensity, pain or burning sensation while urinating. The other signs and symptoms are pink or red color urine, cloudy or foul smelling urine. With the symptoms and the doshic predominance, Ashmari is divided in Ayurveda as Vataja Ashmari. In Vataja Ashmari, due to Nidana Sevana or due to the causative factors, the Vada in urinary bladder increases, by which the urine becomes more dry and it ultimately leads to the stone formation. The symptoms are painful urination and dripped urine. Severe pain will be felt in the umbilicus and the genitalia, flatulence during the urination and defecation, and there is a chances of hematuria. The stones will be smaller in size like that of a thorn. Pitta Jashmari. In Pitta Jashmari, due to the causative factors, urine becomes more acidic in nature and it finally leads to the formation of stone. The symptoms of Pitta Jashmari will be burning sensation in the genitalia and bladder associated with fever and chills, which is also marked with painful urination. The color of urine will be yellowish red and the stones will be larger in size as that of a marking nuts, and the color of stone will be reddish or blackish yellow. Kaphaja Ashmari. In Kaphaja Ashmari, the Kapha dosha gets aggravated due to the causative factors. As the Kapha dosha is having a property of stickiness and oiliness, it binds up the small granules of salts and minerals to form a stone. As a result, the stone is formed. The symptoms of Kaphaja Ashmari will be pricking pain in the bladder and genitalia, cold sensation, heaviness, and stiffness in the painful regions. The color of urine will be white, and the stone having the features which are large and soft in nature and will be whitish yellow or honey-like color. Sukraja Ashmari. In Sukraja Ashmari, due to the constant suppression of semen in the male, it will result in the stone formation, and it is compared with the spermolith. As the person suppresses the urge of passing seminal discharge, the semen gets accumulated in between the two testicles and Vata dries it up. As a result, the stone is formed. In Shukra Ashmari, there will be dysuria, that is painful micturition, and the pain will be felt in the bladder also. The swelling and inflammation of the scrotum and decreased libido. Applying pressure in the area of seminal calculi in the genitalia, which results in the breakage of the stone, and it gets combined with the urine and is passed out through the urine. The types of stones, Ayurveda treatment protocols, diagnosis, home remedies, diet, yoga, etc. will be discussed in our next upcoming videos. Those links you can find in the description box. And you can also go through our blog. Its link is also given in the description box. Divineveda is on for a mission to make Ayurveda heard throughout the world. Come on, let's be a part of it. I request all the viewers to like, share, subscribe on our content, and do comment on our comment section on which topic you want us to discuss in our upcoming videos. Thanks for watching. This is me, Dr. Rukma Rajendran, signing off. Stay home, stay safe, stay healthy. Bye. Thank you.